So before, when I was recording, that was chapter 4, and that chapter was called Hiding Accidents. This is also chapter 4, part 2, and I'm calling this part 2 subtitled Mommy Can't Move, because a lot of things happened as a result of Mommy not being able to move. The time when my daughter called me and said that she was just sitting on the edge of the bed and she couldn't do anything, she couldn't move. So as I said before, that was the beginning of many hospitalizations, many stays within a rehab facility to try to get Mommy stronger and help her to be able to walk. The hospitalizations came because they would send Mommy home, but she'd have to come back because something would happen, and she got to the point where she just couldn't get around well anymore, and they were still trying to figure out what was going on with Mommy's body. And of course they eventually did the imaging, and that's when they found that she was suffering with severe spinal stenosis, which was so painful. I remember Mommy would scream for God. She would scream this high-pitched scream, and she wouldn't cry, she would sob. And she would beg me. She'd call on God, and she'd call on my father, who was deceased, and she'd call on her mother, who was deceased, and she'd call my name, Pookie, Pookie, so many times. Pookie, help me. Please help me, Pookie. And I would just cry because I couldn't take the pain away. Not at that time. I couldn't take the pain away. I felt so helpless. She was suffering. They didn't want to give her strong meds because my brothers were saying, well, she could become addicted. And I'm like, our mother is almost 80 years old. I don't think she's going to have a drug problem, but she can't tolerate this pain every single day, which is what was happening. They were giving her patches. They were doing all this stuff, and nothing was helping with the pain. Not a bit. So my brothers and my sister decided that they wanted Mommy to undergo back surgery, which I did not agree with. I was strongly against that, in large part because I knew it was going to be very invasive surgery. Mommy was old, and she was going through so much. I knew back surgery was going to be like a nightmare. But then I was convinced, they convinced me that, she deserves a chance to walk again if she can. She deserves to have her independence back, because she's always been an independent, strong woman. And so I went along with it. I was reluctant, but I wanted Mommy to have that chance too. So they did the surgery. The doctor said it was 50-50. It could go one way or another. And they did the surgery, and Mommy wound up having to stay in a rehab facility after the surgery, which was normal. And while she was in the hospital, I stayed as often as the nurses would allow me to. I was with Mommy, saw her every day. Sometimes they let me spend nights, and I would spend nights. I couldn't spend the night at the rehab facility when Mommy was at rehab facilities. I think she was at 2 different ones, but they let me come whenever I wanted. They let me stay as long as I wanted, and they let me decorate. They let me do whatever I wanted to do because they knew how much I loved Mommy. And there's a funny story that I'll tell later in the memories chapter. But anyway, they performed the surgery. The surgery went well, and Mommy's rehab was going well. She had gotten where she could walk a little with assistance. She could move from her wheelchair back to her bed with assistance. It was going really well. And then Mommy had this long incision in her back. And it was deep and it was long. And she was, by this point, of course, at the rehab facility. And in these places, they have all of these little old people, and they don't really have enough staff. They have a lot of CNAs who do the best they can, but there aren't enough of them to go around. And Mommy had started doing more strange things. They had her wearing a diaper because she was immobile. And they weren't always coming in as frequently as they should have to change my mother. And they wouldn't allow me to change her because I would watch them like a hawk to see how they were doing it, to see what the process was. And it always took two CNAs to change my mother, to move her little body back and forth so that they could get the diaper on and get her cleaned up and all of that. And I'm watching them because I thought, okay, you guys don't come in here as frequently as you should. I'm here all the time with Mommy, cleaning up her room, making it smell good, making it look nice, making it look like and feel like home as much as I could. And I was like, well, if they don't come in here when you're ringing this, pushing this button to alert them that you need something and they're not coming, I'll just change you myself, Mommy. And they would say, well, you're not allowed to do that for, I guess, accident purposes or liability purposes. You're not allowed to do that. And I said, well, let me tell you that if you don't do it, I'm going to do it. So that means you better get in here to do something, or I am going to change my mother because I'm not going to leave her lying in, fecal matter all the time. So this long. So Mommy had gotten where when the dementia was kicking in hard at times, Mommy would just go into her diaper and she didn't even realize what she was doing. She was scratching herself because it itched because they weren't cleaning her well. And in doing that, the fecal matter got into the open wound. And when that happened, it was over. It was downhill after that because it was badly infected, and there was no recovering from it. They didn't want to take responsibility for their gross negligence, and nobody wanted to take any responsibility, and I just felt like I've got to get my mother the fuck out of these places. There's no rehab facility good enough. There's no these nursing homes, as far as I'm concerned. There's not one that's good enough. They could be paved in gold. They could have great room service. It could be, I don't know, the most beautiful place you could ever see. But the place itself isn't the issue. It's the people that work in the place. And unless you have a loved one in a facility and you're on top of them, these folks, all the time, like I was with Mommy, they knew I wasn't playing with them. They knew I would burn the place down if I had to, if anything went wrong with my mother. But unless you're on top of these people, they can do whatever they want, say whatever they want, subject your loved one to whatever they want, especially if your loved one has dementia, because even if you don't get to see your loved one that often and they tell you what's happening to them, the staff can say, well, you know how dementia is. They're just imagining that. Of course, they'd never pulled that with me because they knew what I would do. So those places were just not like nightmares to me, and I thought, Mommy can't, even for rehab, this place isn't working out. It's just not working out. Mommy needs to be home. Something's got to happen. So that was an issue. And then Mommy was diagnosed while she was in the rehab facility with the vascular dementia. And that was odd because they have people that come in and they do these little tests and play these little memory games. And I was always sitting there watching because Mommy was afraid if I left. And I'm listening to the questions they're asking Mommy, and they'll ask her, where are you? What year is it? Who's the President of the United States? And they didn't actually ask this when it came to addition, but they would something along the lines of, what's 100 plus 1,000 plus 2,000,000 plus a zillion? And I'm looking at them like, what the hell? I couldn't even answer that. How is my mother going to know the answer to that? Do you know the answer to that? Probably not. So I just thought the whole process was nonsensical because they weren't asking the appropriate questions, and they weren't asking the questions of the people that were with my mother all of the time, because they would say, after their little memory games and things, they would say, well, we don't really think that there's a problem with her memory. And I said, you know what? You're in here with Mommy. She's laughing and talking to you. When you leave here, if you come back 5 minutes later, she won't even remember that you'd ever been here. I said, you need to talk to me. You need to talk to my brothers. You need to talk to Mommy's family, the people that are with her the most, because we can tell you what's happening with her. And that's when finally my brothers talked, because they're doctors, of course, and they talked to the surgeon, and they did the imaging, and that's when they found that Mommy indeed had vascular dementia, which is caused, I guess it's contingent on whatever is going on with a particular patient. But in Mommy's case, Mommy had suffered a small stroke some years before, but she did have high blood pressure, so that stroke from the past and the high blood pressure the issue, and that's what led to the vascular dementia. So that's what was going on with the diagnosis, and with Mommy unable to move. And it just became a nightmare very quickly. And Mommy was unhappy. She wanted to be able to come home. They weren't ready to release her, but she wanted to come home, which leads me to the next chapter.